And this is Sandy Marrero with Western Marketing. Today we're going to be talking about Manhattan Life, Central United Life suite of products. With us today we have Roya Garrison, contracting in appointments with Manhattan Life and Central United Life. We're going to discuss the many products they have, and if we have time, we will be doing some sample quoting as well. Roya, with further ado, you can go ahead.
Good morning, everyone. Again, my name is Roya Garrison, and I work for Manhattan Life in the marketing department. I handle the contracting and licensing as well as product training. And today I'd like to go over the different products that we offer with our company, go into some detail, and then at the end, if there's any questions, you can direct them to Sandy, and then we can get those answered for you. If we do not have time to answer all of the questions, it will come in an email format to me, and then we can get that out to you. This meeting is being recorded as well, so I feel that all of you will be able to get a copy of it. So the first thing I'd like to start with is once you become an agent with us, you fill out a contracting link, we issue you an agent number within 24 hours. And then in 48 hours, you have the ability to get onto our website and register with the agent number that you're given, and you will be able to see all of the products I'm going over today, as well as I'm going to touch on points of our website that you probably all will need when you're there, as well as go over our 2.0 platform, which is a new platform we just developed, more of an Amazon shopping cart styled platform that we worked to make it easier for the agent and the client alike. So to get started, this is a product called Affordable Choice. This product is our hospital indemnity product. We developed this plan as close to a major medical as we could without it being an actual major medical plan. We tried to cover all bases of a major medical, but again, this is a hospital indemnity plan. So inside of Affordable Choice, there are 4 plans, Elite Plus being the highest, Classic being the lowest, and 2 in between, Elite and Classic Plus. And what this will do for your client is the top portion is all for hospitalization. So if we're looking at the Elite Plus, when your client is hospitalized, they're going to receive $3,000 for the admission benefit, and then they will receive $5,000 for every day that they're in the hospital. And then what we did is we added a building benefit injury reimbursement. So in years 2 through 5, if your client is hospitalized due to an injury, we're going to increase the inpatient hospital confinement or the daily room benefit. We're going to increase that by 25% each year to give them more money back to them if they are hospitalized due to an injury. Now, if they're hospitalized between years 2 through 5 due to a sickness, they will receive the $5,000. But if it's injury related, again, they'll receive these amounts in these years. We also have an emergency room and an urgent care benefit. We have 2 visits per year to the emergency room and 4 to urgent care at $250. We gave more to urgent care because we know it's it's greatly cheaper to go to urgent care versus emergency room. The surgical benefit will allow 3 times the policy fee schedule for the surgery that your client has. And the fee schedule is based upon the Medicare physician's fee schedule in Texas, which you can Google, and whatever that amount is, 3 times that amount is what the surgery benefit will pay. We also have the ambulatory surgical benefit, which is $3,000. So if they go to an outpatient facility or ambulatory care facility, they'll receive $3,000 for going there. And then the assistant surgeon and anesthesiologist are 20 and 25% of the eligible surgical benefit. Now, one thing before I move forward on this plan, I want to let you know this is first dollar coverage. So as soon as you write the plan, it passes through underwriting. The premium post to the policy, the client can use this plan the very next day. If they have to be hospitalized the very next day, this plan will help them. If they need to go to the doctor, this plan will help them. Again, first dollar coverage. There is a doctor visit benefit, and we have allowed a rollover provision on this benefit. So your client will receive 10 doctor visits for a year at $100. But let's say this year, maybe your client's not that sick, they don't need to go to the doctor that much. 5 of those visits can roll over into the next year, essentially giving them 15 visits for the year. Now, those visits can be used at a doctor's office, it can be used at a chiropractor, it can be used, let's see, doctor and chiropractor for sure. So they don't just have to go to an actual doctor visit, to an actual doctor. They can, for a medical checkup, they can go to a chiropractor too, as well. There is a prescription benefit as well, which is $75, and that is a per day benefit. So for them to maximize that benefit, if they receive 4 prescriptions, let's say from the doctor, and it's feasible for them to have those prescriptions filled over 4 days versus having all 4 filled on the same day, they can receive that $75 for every day they have a prescription filled. And that really works well for some of the clients. It helps them, get more money back to their pocket. We have an outpatient medical benefit. So for colonoscopy, pap smear, PSA, these are the amounts that we will pay. Another way to maximize this benefit is if your client has to have a colonoscopy and they have it in the ambulatory care facility, they can receive the benefit for the colonoscopy and the $3,000 for the ambulatory benefit. Instead of going to a hospital to have it done, sometimes it's cheaper to have it at an outpatient facility. So they will get the $3,000 plus the $600. For laboratories, we have surgical pathology at $300 and any other kind of lab services for $50, and that is again a per day benefit. Therapy services for physical, occupation, and speech, $75 for any 3 of these services that they may need. And we increased the amounts that we pay off for radiology services. So for MRI, it's $700, PET scan, $700, CAT scan, this is mammo, and then this is any other radiology test. So anything, chest x-ray, arm x-ray, back x-ray, anything like that. And then we give $8,000 per calendar year, and calendar year is the policy year. So it's not January to January, it's from whenever you write the policy to the next year on the same date. This amount applies to all of the benefits here. And what we did for the radiology services to further help your client is we partnered with a company called Green Imaging. Green Imaging is located all over the United States. They have a website that we'll go over in just a moment and a phone number, and your client can actually call them, tell them exactly what they're having done, and they will quote them directly over the phone, so they know before they step in the door how much that test will cost. And Green Imaging deeply discounts all of their radiology services. So we've seen MRIs as low as like $300 and $400. We've seen CAT scans that low. So it's just a way to help them maximize this benefit. For air and ground ambulance, it's $150 for ground and $1,000 for air. We've also added the allergy shots and immunizations. And that is for children only. It is not for adults. We do have that question a lot about allergy shots, but it is for children only. And it's 10 for allergy and 25 for immunization. And then we added a cancer benefit. And on this cancer benefit, it goes hand in hand with our cancer plan, which I'll go over in just a moment. But for the radiation, chemo, and immunotherapy, if your client is diagnosed with cancer, we'll pay $2,000 per day, up to 40 days in their calendar year while they're going through treatment. But I'll also show you in a moment how to maximize that benefit in just a moment. For the inpatient and hospital confinement and the building benefit injury reimbursement, it's $1 million calendar year limit. The prescription has a $750 calendar year limit, Allergy shots and immunizations is $100 for the year, and the lifetime max of the policy is $5 million. Now, one question that we get a lot is if you write this on, an individual spouse, individual and family, do they have this amount for each person, or is it divided between them all? It is for each person. Each person that you write on this plan, all the benefits that I've just gone over is for each individual person on your plan. These are the prices in Texas. I am pulling up Texas brochures. Prices and some benefits can vary depending on which state you're writing this policy in, but we'll go over that in a moment when I go over the website. The policy itself is age banded. The writing ages are 18 to 64, and these are your age bands. And then this are the different tiers you can write in each age band. Elite Plus, Elite, Classic Plus, and Classic. Also, the child only benefit here, you can write this on a child. So if their parents have health insurance through their job and it's too expensive to add their child on, you can write this as a child only policy as well. I personally have this on my children. It works out great. So as I was speaking before, Green Imaging, this was the partner that we have now for the radiology services that they offer at a discounted rate. If you want to contact them, here's their phone number. And again, this is being recorded, one, and then two, I'll show you where to get this brochure when we are off this call. But this is how you can contact them. Your client can contact them. The price that they give you is for the exam and the radiology fee. So they're not going to be hit with an additional additional bill for the radiologist reading their report. It's both. They get both when they're quoted on this using the system. We are in network with a company called First Health Network. We were in network with a company called Multiplan. But we moved to First Health Network because they have a broader, more extensive hospital doctor relationship. But that doesn't mean that your client necessarily has to go to, stay in network with First Health. If they stay in network with First Health, they receive additional discounts on their plan. It works for more money back in their pocket. However, if they can't or they won't, they're used to going to one particular doctor, one particular facility, the plan will pay as it states in the brochure. They just won't receive the additional discounts for staying in network. We also have the prescription benefit card or the discount card called RxEDO. However, if you are used to using a particular discount card, that's what you give to your clients when you write plans on them. They are free to use that card as well. We just add this because it comes with the plan with Affordable Choice. But again, if you feel more comfortable using another one over this one, please feel free to use that. It will not affect the way that the claim is paid back to the client. So no matter what they pay on their prescription, $3, if let's say, they'll still receive the $75 on Elite Plus, once they file the claim. We have partnered also with Teladoc. Teladoc is a very underutilized benefit of this plan, I feel, because your client can sit right at home. They can get consulted and treated by a physician right over their phone or their laptop or their iPad. They never have to leave their house. The doctor can then call prescriptions in for them. They can pick them up. There is no fee for using this plan. It's included in the premium. So if they use it one time or they use it 100 times in the year, there is no fee for that. I know there are times when you have to go to the doctor itself, but if they can use Teladoc, if you push it, again, no fee out of their pocket. They don't have to pay for anything. And we recently switched from using Caris 360 to Health Advocate. We found Health Advocate was a little easier for the clients to work with as far as negotiating bills, finding facilities, finding doctors. hospitals, whatever they need, even RX for their prescriptions. They can help them find where they can get the cheapest prescription. Um, they will all around help your client maximize the benefits of this plan. Their information is here. If your client wants to reach out to them once the plan is in place, and then this is their website. They will need a policy number, by the way, when they reach out to them. So that is our affordable choice plan. That may bring questions in, and again, I'll answer those questions at the end of this call. I did want to show you a quick comparison on the claim. So if your client has the Elite plan, they're in the hospital for 7 days. This is the amount that they were charged. They stayed in network with First Health. This was their discount. So the current balance is $22,913.23 that they would need to pay. When Affordable Choice benefits kick in, they'll receive $2,000 for the admission. They were in the hospital for 7 days at $3,000, so they'll receive $21,000 for that benefit. So the total amount paid would be $23,000. So that is significant, well, not significantly, but it's less. I mean, it's more than what the current balance is. So the client would be able to put some money back into their pocket. And whatever we pay, if the hospital files a claim or if the client files the claim, if we're paying the hospital, whatever is left over, we send directly to the client. If the client files the claim, we would send the money to the client, and then it would be their responsibility to pay the hospital. Same thing for Classic. They went in for an office visit. It was $50. That's what Affordable Choice pays. The office visit was $95. Lab test $25. They charged $90, so the total bill $90 and $95 and $90 was $185. They received a $55 network discount. The Classic plan pays $75, so the balance that they owe on a $185 bill is $55. So that's just a couple of examples. This is for a broken arm if they were in the hospital. They had 4 office visit follow-ups. They had 5 x-rays. The total bill, $2,384. Again, they were in network. This is what the Elite plan pays, and this is what their balance is compared to this amount of what their total bill was. So those are just some examples of how the claims are paid on this plan. We have a lot of agents that sell a lot of this plan. So I hope some questions come from this. I feel it's a good plan myself. I don't know if I'm biased because I work here, but I really feel like it's a very good plan to have. Now, speaking of affordable choice, I wanted to also go over the GAP plan really quick. The GAP plan is a very simple plan. It is just that. You can write it with affordable choice. You can write it with the major medical. You can write it as a standalone. Either way is perfectly fine. Again, very simple. It has a inpatient hospital confinement benefit of $100 or $200 a day. It has a admission benefit of $2,500, $5,000, or $6,350. And again, as you can see, these check marks the client can choose, depending on the premium they want to pay. And then 2 doctor visits per year at $50. Those are the mandatory benefits. The optional benefits, riders they can add, outpatient surgery benefit of $1,000, $2,000, or $3,000, and then 4 emergency accident benefits. And that does include both urgent care or emergency room. And they'll receive $250, like I said, 4 visits per year. So we see a lot of agents that couple these plans together. One reason we see a lot of them coupled together is if you have a client who is thinking about family planning, they want to have a baby, as long as conception happens 3 months after the policy is in force. When they go in to have the baby, this will cover while they're there, the admission benefit, and 2 doctor visits afterward or before, depending on how they want to use it. So that's just something to take note of. Affordable choice, on the other hand, doesn't cover anything pregnancy related. It will cover the mom if there are complications due to the birth. That's the only time affordable choice will kick in. So that's another reason why a lot of people write these two plans together. The next plan I want to go over was the cancer plan. The cancer plan, as I was talking about, is the cancer benefit that was added to affordable choice is a way that they can maximize that radiation, chemo, and immunotherapy benefit. I don't know if anybody has cancer in their family, if any of your clients have cancer in their family, but it can be a devastating financial loss if you are diagnosed with cancer and all the treatment that you have to go through. This plan is the very first plan Manhattan Life had on the market. This is our core product, so to speak. We have never changed premium. We've never changed the benefits of this plan. And it surpasses a lot of the cancer plans that we see out on the market. One thing that surpasses it is the radiation, chemo, and immunotherapy benefit. We pay actual charges up to these amounts per month with no lifetime max. So no matter how long they're going through their treatment, if they go into remission and it comes back, it makes no difference. We're still going to pay these benefits amount while they're going through the treatment that they have to have. There is a surgical benefit of these amounts. So if they have to have a port, if they have to have anything drained, anything that would make them have to have any type of surgical procedure, these are the amounts that we'll pay for surgery. We also have a first occurrence rider. So, again, it's devastating to be diagnosed with cancer, but what's even more devastating is if you don't have money in the bank saved up for getting everything together while you have to go through treatment. So we have anywhere from $1,000 to $10,000 to offer to your client as a lump sum payout in addition to the rest of the benefits on this plan, just to help them get set up, get some money in the bank, get some bills paid, less to worry about. And then let's say, your client doesn't have cancer, but they get screened every year. Well, on the screening benefit, we're going to pay your client $50 or $100 just for going in and having a cancer screening, Pap smear, PSA, colonoscopy, anything related, a regular doctor visit, with a screening when you go in for your Pap smear or your mammogram. We're going to pay the client back $50 or $100 depending on which plan they have. They just file the claim and we'll send them a check directly. And then there's a hospital confinement benefit of these amounts. So if they're confined to the hospital, they'll receive these amounts while they're there per day. Now, again, I want to point out there is no lifetime max on this plan. Remission comes back. These benefits will pick right back up and help your client. And in addition to cancer, these dread diseases are also covered at the same payouts as the cancer plan up here to help them while they're going through treatment for any of these plans. Now, what I can tell you from past webinars that we've had, a lot of people like that the sickle cell anemia, the epilepsy, and the lupus and the multiple sclerosis are all covered on this plan for a later diagnosis in life, or if you write on a child and, later in their life, they've kept the plan, any of these diseases happen to them, this plan will help them while they're going through their treatment. There are also benefits, ambulance, physician's attendants, drugs, government or charity hospitals, extended benefits. So if they stay past the 71st day, the extended benefits will pay. Hospice care, extended care facilities, private duty nursing. We also offer something that a lot of cancer plans don't offer is a transportation benefit. So, if your client has to travel for treatment, we're going to pay them the mileage. We're going to help them pay for lodging. We're going to help them pay for meals while they're out. This particular benefit is for bone marrow, but they also have, just any kind of transportation that they need to use to travel to get their treatment. Also, the adult companion and transportation lodging benefit is something that we offer, because who wants to go through that treatment by themselves, husband and wife, friend and friend, however it's going to work, whoever they're taking with them, we're going to help pay for their meals and lodging as well. On top of that, again, bone marrow, breast reconstruction and prosthesis, artificial limb, outpatient surgery, additional surgery, anesthesia, skin cancer, home health, rental and purchase of medical equipment, mental health, outpatient positive diagnostic test, experimental treatments, blood, plasma, hair piece. Here's another benefit for the occupational, physical, and speech therapies, tutoring for a child under the age of 19. And then in these 3 states, there's a mammography benefit, and in California, there's a pap smear benefit. So all of this would cover them, not just for cancer, but also for the dread diseases while they're going through treatment. And then on top of that, we have 2 optional riders. So we have the intensive care rider and we have a critical care rider. The intensive care rider would help them, if they are admitted into intensive care. And this benefit can also be used even if it's not cancer related, the reason they're in intensive care. So if they're out, God forbid, they have a car accident, they can file this ICU rider. If they purchase it, they can file a claim and they will be reimbursed. And then on the critical care rider for a heart attack, stroke, things like that, this is just an additional benefit that they can add to the plan. So this is our cancer plan. The other plan I want to go over is the critical protection and recovery. Again, underutilized plan. I think it's a very simple plan. This plan would cover any of these critical illnesses. There's a lump sum benefit that will be paid to them should they have any of these illnesses or events, I should say. Then we're going to pay them a monthly benefit of these amounts while they're recovering for 12 months, 10% of whatever we pay on the first occurrence benefit. And then there's a reoccurrence benefit. So if it comes back 365 days later, let's say cancer, or if they have another critical event 1 year later, then there's another benefit that can pay directly to them. So just to help them get back on their feet. And then we'll supplement a little bit of their income while they're recovering. This also includes a confinement benefit, ambulance, transportation, lodging, just like cancer. So if you write them together, they'll be covered for cancer, they'll be covered for heart attack and strokes, any critical illnesses that may occur in their life. And then we have a waiver of premium. So if they, have this event, they can't go back to work, they can't pay their premium, we will take care of it while they are recovering. That's critical protection and recovery. I don't know if a lot of you have seen our dental, vision, and hearing plan. This is a plan that we have out on the market. The dental, vision, and hearing plan will cover either all of the benefit to dental, all of the benefit to vision, all of the benefit to hearing, or your client can use it between the 3, between 2, just depends on what their needs are. You can write this plan on anyone age 18 to 85. It is a guarantee issue product. The rest are underwritten, by the way. I know I didn't go over that on the plans. This, like the other plan, first dollar coverage. We offer $1,000, $1,500, and $3,000 benefit for the year. This is the only plan that we have that has a deductible. None of our other plans have a deductible, but it is taken from the claim when they file the claim. So the dental plan, all of them, the way the years work is the first year is 60% payout on the claim, second 70, third year and after is 80. Preventative services for dental covered immediately, no waiting period, and basic services, so exams, cleanings, fillings, an extraction other than full mouth, all of that is covered in the first year. Anything major is covered in the second year and beyond. So crowns, bridges, dentures, full mouth extractions, root canals, all of that is covered in the second year and beyond. Second year starting at 70%, third year 80, and then 80 for the rest of the lifetime of the policy. There are two things that are not covered on dental, and that is implants are not covered and orthodontics are not covered. Those are two questions we get a lot from the field. So those two things are not covered. For the vision coverage, the basic eye exam, refraction, those are covered immediately. There is a 6-month wait for eyeglasses and contact lenses, but after that 6-month, first year, again, 60, second year, 70, and third year and beyond, 80% payback. For hearing coverage, the exam is covered immediately in the first year. There is a 1-year wait for hearing aid repairs and new hearing aids. So after 1 year, if they needed any repairs to their current hearing aid, they could have that done, or it could help them pay some of the cost for the hearing aid itself. Even though I know it costs a lot, it will help them pay some of the cost down. It is age banded. This is your individual premium. These are your yearly max amounts, 18 to 39 and so forth and so on. These are your family coverages. And then any child, if you have a family and they have any more than 3 children, this is the additional cost for the 4th child and beyond. And another thing I want to let you know, that if you're writing just a husband and a wife and you're looking at this premium and you see that there's a significant difference in the premium for an individual to a family, what you would want to do to help the client save the most money is you would want to write 2 separate individual plans. That way, that'll save them a lot of money in the premium for the year. We are in network with the Carrington network. Your client does not have to stay in network, but it works the same as Affordable Choice. So if the doctor or the dentist or the eye doctor or hearing doctor that they're going to is not in network with Carrington, they still go. The benefits will still pay. They just won't receive that additional discount for staying in network with Carrington. It is guarantee issue, as I said, and it's guarantee renewable for life. So if you're writing someone and they're in 85, as long as you write it before they turn 86 and they continue to pay the premium, they can keep the policy as long as they pay the premium. That is our dental, vision, and hearing plan. And the last plan I want to go over is the paid accident. It is just that, it's an accident plan. And again, I didn't mention this with our other products, but I want to mention it now that we're talking about paid. We do not coordinate benefits. So it does not matter if your client has insurance, major medical, an indemnity plan, it doesn't matter, dental plan. We're not going to coordinate benefits. So no matter what their plan currently pays, we're still going to pay exactly what's listed on our brochures for the payouts for whatever services they have, depending on which plan that you write on your client. The paid accident plan. Okay, let me start here. So the accident plan helps pay for out-of-pocket expenses. You can write it for 24-hour coverage or off the job only. The issue ages are 18 to 64. It is guarantee renewable to age 70. And then you have the option to choose between 1 or 2 units. In some states, we offer the disability income rider. So if your client is hurt due to their accident and can't go back to work, we can offer them a $1,000 or $2,000 benefit amount. We have 2 elimination periods, 14 days or 30. So just depending on when they want those benefits to kick in. A duration period of 6 months or 1 year. And then we have 2 occupational classes, class 1 and class 2. Class 1, secretary, we're not doing a lot of lifting, kind of sitting at a computer all day. Class 2, more manual labor. Maybe you're outside a lot, you're lifting a lot of different things. That's how the classes work. But there is a list, which we'll go over in just a moment. I'll show you where to find that, that really defines which class, which occupation falls into which class. We also have the optional annual wellness rider. So your client can receive $60 back to their pocket for any of these procedures that they have done, but the policy has to be enforced for 30 days for this benefit to kick in. It is an additional premium, which I'll go over in a minute because it's more like a rider to the plan. So again, the disability income rider, here's your air and ground ambulance. There's an accidental death benefit that's on. Then there's another accidental death benefit via common carrier. So plane, bus, and train, it'll double this amount if they were to pass away and they were on any of these three common carriers. Emergency room benefit, hospital admission, confinement, intensive care, CAT scan, angiogram, MRI, anything of those tests is here. Here's your physician's office. And then if you need plasma or platelets or blood, these are the benefits that would pay. And it covers burns, dental work, dislocations, fractures, gunshot wounds, laceration. All of those benefits are here. Lodging, so if they have to leave, and they go to a different hospital that's more than 100 miles away, we'll help them for the lodging. Eye injury, knee cartilage tear. Here's a transportation benefit, surgery, and it goes on. So we have the epidural pain management, physical therapy, rehabilitation unit, prosthesis, accidental dismemberment, and appliances. All of that is covered on this plan. So you can write our plans together. So if you see a benefit here, like for instance, the benefit for the hospital stay, right? So the confinement. So if you write this plan and you write affordable choice and they're in their second year and they're confined due to their accident, they're going to receive 25% more of the benefit while they're in the hospital. So they could essentially, let me see if I can find it really quick. So if you're looking at this, so let's say they're in their second year, they're going to receive $62.50 for every day they're in the hospital due to their injury. If they want to also file the same claim with this paid accident, they're going to receive additional money for being confined. The admission and confinement. You can write any of our plans together. You can file claims across all of our plans, if they have some of the similar benefits. So it's just another way to maximize the benefit for your client. So as I was saying, you have you have 24-hour coverage, or you have off the job only, and you have 1 or 2 units. Now, the reason we've broken this down in these sets is because all of our plans, while they are individual plans, you can write them in a group setting. There's an additional form I could send you. As long as your group has 3 or more people, you formed a group. And if you formed a group, they can, the employer can take the money directly from the employee and pay the premium per month. So if you're trying to break it down for a group setting, we have weekly, biweekly, and semi-monthly premium here for you to show the client what would be coming out of their paycheck. But if you're writing this on an individual, these are your monthly premiums. So this is just a standalone product. Again, 1 unit, 2 units, 24-hour coverage or off the job only. And then that wellness rider I was talking about, this is the additional premium for the wellness rider, monthly. This is weekly, biweekly, semi-annually. And it's also broken down employee, employee and spouse, employee and child and family. And by the way, no matter how old they are, everybody pays the same rate on this plan. And then this is the disability income rider and their pricing. So $1,000, class 1, class 2, $2,000, class 1, class 2, and then you have your elimination and duration period. So that's pretty much our portfolio outside of life. I really looked at your production. I don't see that you all write a lot of life, but if you ever wanted to go over life products, we can do that at a later time. What I'd like to touch on really quick now is our website. So on the website, as I said earlier, once you're issued an agent number, everyone has a website that looks just like this website. You'll go in, you will click on a link. It's going to take you to a page that looks like this. You will click on I want to register. I know you all will read these terms and conditions, and when you have, you can click next. Put your agent number in. Once you put your agent number in, you click verify, and then it's going to ask you for your tax ID and your zip code, and it will be the zip code that you entered on your contract. Once that's been accepted, you click next, and that's where you can create your username and your password. After you've done that, we have the home page of our website. We call it our dashboard. You have a lot of different information on this website. So the first thing I want to show you is if your client sends you anything paper related, a claim form, maybe they don't want to do online, an online app. Maybe they want to do paper app for some reason. If you take anything paper related, we have this easy upload section right here. All you have to do is choose the product you want to write, that you've written, or the claim form that you have. Enter your client's first and last name and their date of birth and any comments you want to make. This can be anywhere from underwriting to claims to apps to anything you have paper related. Instead of faxing it and wondering where it went, you always have a way to track it. You can always click this view history button and it'll be right there for you. Another thing that we have is this commissions tab. Under the commissions tab, you will be able to view any commissions that you received. You'll be able to see who you received the commission for and what that amount was. And it will come in a transaction and it will come in a statement format. Any business that you write, under this Enforce Business tab, you just click on this agent policy list and it will populate every policy that you write, the policy number, the name of the applicant, their email address and phone number. And then to click into it further, you'll also have a copy of the policy. You'll have a copy of their card if one is issued for that particular plan. And you can also see their status. So if it's pending, or if the premium was rejected 1 month for some reason, maybe they changed bank accounts. All of that information lists under Agent Policy List. Under the Agent Tools tab, you can order supplies. We're working on this group enrollment, so right now, while you can click on it, it's better to wait till we get the new enrollment site up and running. If you write Medicare Supplement with our company, you'll find those Medicare Supplement links right here where you can submit your Medicare Supplement business online. And then under enrollment links, what you will find is, well, you'll see your Medicare Supplement link, but you're also going to see, well, while the health products are here, they've moved to our new platform, which I'm going to show you in just a moment. So what you will actually see are just these life products. So if you want to write the life products online while we are transitioning them over to our 2.0 platform, this is where you will come, and all you have to do is click on the link. You're going to enter the information about your clients, so whatever their birth date is, gender, are they a tobacco user, what state are they in, what's their payment mode, what's their effective date. You hit get a quote. It's going to give you the price. It's going to give you the face amount. It's going to give you the pricing. Do you want to add accidental death? If you do, you just simply click that, click apply, and then there's your app. So what you're going to do with the application is once you go through it all and you've answered all of the questions, The only signature that we need, no voice, no e-signature, all we need is for you to type in their mother's maiden name. We can pull that directly from their MIB report to verify that that information is correct. That being said, it is not your mother's maiden name. We had a lot of agents that submit it that way. It is not your mother's maiden name. It is the primary insured's mother's maiden name that goes here. And once you click submit, comes in, we process it. So again, this particular platform, life only. You will not see these health products, and I'm going to have to remove these in just a minute from Western Marketing, but you will see just life products here. But what I'm proud to show you is the new product that the new enrollment platform, which you can access here under Agent Tools, or you can access it here from your dashboard. Oh, sorry. Just one second. You'll click the blue click to launch button. What that's going to do is it's going to redirect you to our 2.0 homepage. Now it does look a little bit different than the link that we just looked at. This process is more designed for you to write multiple products on if you wish. And all you have to do is click this green Get Started button. So you've hit click to launch, you're redirected to 2.0, then you're going to click Get Started right here. Another thing that we've added is a leader conference. So every year we offer a trip. We offer 2 trips a year. Thanks to David Harris, the owner of our company. He really likes to show the agents how much he appreciates you all for the hard work that you do. And you will be able to keep up with your numbers. And I will give you information about the new trips that are coming up. The contest just ended for last year's trip. So when the new trips come out, we'll get information out to you all with how much qualifying numbers you need. And then hopefully we can see you on those trips as well. So to get started on 2.0, you're going to click the Get Started button. You're going to enter in a zip code. It's going to verify the city and state for you. You'll click Next. You're going to enter the birth date. It's going to verify the age for you. You're going to put in your client's information and the gender, and you'll click Next. If you have any dependents to add, you're going to add them here. Now, one thing to know about the dependent section is once you enter their information in, make sure you click Add to add them into the quote. If you do not click Add, it's not going to add them in. There is another place I can show you where you can add them in, but if you click Add there, a new line will come in to let you know that the next dependent is ready to be added. Oh, sorry. So you can click Add. Now you have a spouse and a child and an individual on this plan. If that's as far as you need to go, you can click Next. Here's your effective date. It's always going to default to the next day. However, feel free to type in any date you want, or you can choose from the calendar if you wish. And you're going to click Next. And now what it's doing is it's compiling a list of all the products that are available to your client by age and state. Now here's a list of all the health products because again, we haven't moved life over just yet. So what you will do is you'll just click on the product you want to write. Here's Affordable Choice. Here's your brochure. So you don't have to swap between both of the website and this platform. It's right here for you. Here are your plans. Here's your effective date. Here's your payment schedule. And here's your dependent information. Now, as I told you before, if you get in here and then you say, oh, wait, I forgot to add a kid, or I need to make a change. There's 2 things you can do. One, maybe the spouse doesn't need this plan. You simply uncheck them off this plan. And now they have been removed from the plan, not removed from your quote, but removed from the plan because maybe it's only the employee and child that need this plan, but the spouse needs dental or vice versa. So you have the ability to to take away any dependent that you've added to the plan. You also have the ability to add another dependent. So if you forget one, just simply click Add Dependent, put in the child's name, put in their date of birth, click Add, and there they are. And it upgrades the premium for you every time you do that. So once you've done that, you click whichever plan you want to write on them. Now it tells you it's in your cart. You want to return to your product list. Now your cart is being made. So now you have affordable choice with an individual spouse with 2 dependents on the Classic Plus plan, and this is the monthly premium. So now you just go through and pick whichever plan you want. So if let's say you want dental, click dental. There's your brochures. There's your effective date. There's your benefit amounts. You'll choose which one you want. It's in your cart. Return to your, and these are your dependents, by the way. So if you needed to take away any, there they are. Return to your product list. So now you have 2 plans in the cart. This is your total premium. If everything looks fine with you and the client, you'll click Begin Enrollment. Now there's a couple of things you can do here. The first thing you can do is you can save your quote. You don't have to save it here. If you get halfway through this application process and your client has to call you back, feel free to save it at that point. No matter where in the quote you are or where in the app you are, once you save it, it's going to retain that information until you come back and you click on it, and I will show you in a moment where you can find that information. Another feature that we have is the send quote option. So if your client's like, I probably need to talk to my spouse about this, I don't know about it, or I need to take a minute and think about it a little bit, you have the ability right here to send the quote. You do have to name it first though. So if you name it, it's going to ask again for their name. It's going to ask for their email or their phone number. So you can either send them an email. It's going to give them the quote right there, tell them what you went over. It's going to have a link to open up the brochures if they wanted to read it on their own, again, by text or email, either one. And if you save it, and you get more down to the app, like maybe you save it and then they say, well, we can go on and start, and then you're still going through this application process, and then they need to call you back, always make sure you click this update button, and it's going to ask if you want to update your current enrollment. So it will save the information that you've entered into our system wherever you are in the process. So what you're going to do is you'll just like a regular app, and the reason I want to, and again, this application process is every question you need to ask for both of the products. You're not going to be asked the same the same question twice. Okay, so everything is answered at one time. As you're answering these products and you click next and validate, which by the way, they have the exact same function as clicking between these tabs, this section will turn green. If it turns green, that lets you know that first section is completed and it's time to move on to the second one. If you don't want to do email consent, maybe they're rushing you and they want you to do the application questions, feel free, click on application questions. It'll take you right to them and you can answer that. If you have a question on, if there's a question on these application questions that need more information, there's your drop down for you to enter in your free text, whatever it is you need to add there, milligrams, what they're taking, how often, all of that information is here. Let's see. So just quickly, I'll go in and, U.S. citizen. Oh, if you have a client that is not a U.S. citizen, but they have an ITIN number, that's perfectly fine. So if you click no, just make sure you say client has ITIN number of, and whatever that number is. That is for all of our plans. That's health and life alike. The client does not have to have a social in order for you to write, but they do have to have the ITIN number. So as you're going through here, you're answering all the questions. All right. Oh, I missed one. Had to. Let's see. Oh, right here. Oh, yeah. And if the question is answered yes and you don't put anything in the box, it is not going to validate this page for you. Just as a little reminder to let you know that you've forgotten something. So now your test has said, okay, I need to call you back. You've answered that. This is where you're going to click update. This is where you're going to click yes. And then again, those answers are saved. Now, one thing I like to go over with all of the agents is this payment section. So under the payment section, it's going to ask you for two different ways to pay. It's going to ask you for automatic bank draft, which is monthly. And it's going to ask you for bill direct. If you click on bill me direct, it's going to change the premium to either quarterly, semi-annual, or annual pay. So I want you to be aware of that before you do that. So when you click on automatic bank draft, you're going to enter your routing number. Click validate. When you click validate, there's the bank. You put in the account number. Now there's two things I want you to keep in mind. On this desired withdrawal date, it does say between the 1st and the 28th. However, when you're entering the number here, it will only take a number. So you wouldn't put 1st or the 3rd or the 5th. You have to put 1, 2, 3, whatever date you want the policy withdrawn. That's first. Secondly, I had Web add the effective date here. And the reason I did that is because you only want the withdrawal date within 3 or 4 days of your effective date, if not on the same day as your effective date. So if you're writing this plan later in the month, let's say your effective date is like 6/20, right? You do not want to choose the 1st as the withdrawal date, because the way that the system downloads the information into our system, it can cause a double draft on the client, and nobody wants to go through that headache of trying to get that corrected. The client's mad, and maybe you just snagged the client and you're trying to, you don't, whatever your situation is, if you can, just make sure whichever withdrawal date you choose is after your effective date, 1, and 2, within, 3 to 4 days. Just to keep your client in a state where they're not double drafted. Because again, nobody wants to go through that. You all are too busy to have to stop and call in and talk to us. Your client is going to be frustrated and mad, and then you have that whole waiting period of the money has to clear, and it's a mess. And I hate for clients to have to go through that. I hate for you all to go through that. So I always like to bring that up on my webinars, and that might draw some questions. And if it does, please let me know. I can answer them the best that I can. But that's just my own opinion on these apps. So after you have entered your information, again, your section is green. It's going to ask for your dependent information, and all that is, it just complete it. You're going to go in and answer the information for each dependent. You're insured, again, mother's maiden name of the client here. What we did add is we added the ability to send the policy via mail or email. So if you have a client who likes to get all of their information through email, please feel free to click that email. It'll email the policy directly over to them. If there's a card involved, though, it is going to come in an email format that they would have to print out on their own. So that's just up to them how they want to handle that. And then for you, the signature for the apps, it's going to verify your agent number. So just make sure that looks right. Here, it's going to ask you if you're replacing. If you are, if you're not, it's the same. And then all you're going to do is you're going to check yes, that you certify everything that you've entered is correct. Also, I don't know if you all have any type of situations where you split business between 2 agents, but if you do, you also have the ability to split your business here. You just need to know the agent number and the first and last name of the other agent you're splitting business with, and then enter the percentages here. So that is everything I can tell you about Manhattan Life. The only other thing I really wanted to go over with you is just that we have been in business since 1950. Our product line. Started with a cancer plan I went over with you, and we have just expanded from there. We have a wide variety of products, even that I haven't gone over. Medicare supplement, we have annuities. We're coming out with some new products on the market very soon. So I'm very excited that all of you joined the call today, and I really hope that if you have any questions after the call, you can let Sandy know and he can tell me, or he can give you my information. You can email me directly. I am here to assist you in any way that I can. So are there any questions, Sandy, that I can answer for you?
Well, thank you very much, Roya. There was a question here. Give me 1 second. Let me see if I can find it for you. It was related to the hospital indemnity on the claim side.
On the claim,
clients, okay. Yes, the clients submit the claims, or how does that work?
So
pre-existing conditions. Mm-hmm.
Oh, okay, pre-existing. Okay, so pre-existing conditions, there is a 1-year wait on pre-existing conditions. And as far as claims are concerned, the client will have a card that they can present to the facility or to the doctor, and the network, can take care. I mean, and then the facility or the doctor's office can file the claim on the behalf of the client, send in all the correct information to get the claim paid. Or if the client chooses to say that they're self-pay, they're paying out of pocket for everything, then they want to file claims for the bills after that directly to Manhattan, they have that option as well. So it just depends on your client situation. Normally, people use their cards though, so that it's handled all through the network, through the Affordable Choice card.
So if they go through the network, present the card, they don't have to worry about submitting claims.
Exactly.
Easy. Okay. On the dental insurance, you mentioned the age was the age, but then you also mentioned a children's policy. Does that mean that you can actually, is it a standalone? Can you get a standalone children policy?
No, the only standalone you can get is on Affordable Choice for a child. For dental, the child policy or the child information I was going over was for the 4th child and beyond in a family setting.
Okay.
It's an additional premium. So like really quick, so if you're looking at the dental plan right here, it says family rates include up to 3 children. Additional children are charged the 3 to 17 rate per person. So depending on how old, depending on which which yearly max they get, for the 4th child, 5th child, 6th child, like that, each child is charged an additional premium depending on what the yearly max was.
Fair enough.
You cannot write it out as a standalone on a child.
Fair enough. All right. Then that was actually all. I'm going to continue with the conversation with some of the agents. Some of them are going to be getting contracted with us in a few minutes. I'm going to be sending you guys contracting links for you to complete your contract. And like Roya said, you will be able to get the writing number within 24 hours, and we'll be able to write the policy within 48 hours. It's very important for you to complete that contracting link in order to get that. And if any one of you need a refresher of what we have discussed, I'm going to also send a copy of the webinar with which will answer any questions that you may have. And also you'll have Roya's information as well sent to you as well. With that said, I want to thank you, Roya, for participating on this webinar today, and I hope that everyone is well, and let's get going and get everyone set up with Manhattan Life, which is one of my favorite companies in the market. So.
Yes, thank you all. Thank you all for joining. And again, any questions, please feel free to send them my way. I'll be more than happy to answer any questions that anyone has.
I appreciate it. Thank you.
Thank you.